This past Saturday was Aortic Disease Awareness Day, and in light of that, we're learning more about this disease, which isn't often talked about.
Well, there are many things we can do today to help us reduce our risks. Here with everything we need to know is physician and vascular and aortic surgeon, Dr. Sophia Kahn with UT Physicians, and her patient, Cheryl Brown-Taylor. Ladies, welcome to Houston Life. Great to see you both.
Thanks for having us.
And of course, Dr. Kahn, we do want to mention that September is Women in Medicine Month, so we're clapping to you and saluting you. We appreciate that. Let's first, before we get into Cheryl's story, let's just get an overview of aortic disease. What are some of the common symptoms?
So interestingly enough, with aortic disease, some people will have really bad chest pain or back pain, or they'll have belly pain. And some people, it's actually just found because they went to get another CT scan for another reason, or their primary care doctor picked it up on physical exam. So the symptoms kind of vary between patients.
And is it something that is genetic? I mean, who is at risk for this disease?
So patients who are smokers are predominantly at risk. There are genetic syndromes that can put you at risk. So patients who have ever smoked at over the age of 65, patients with high blood pressure, also patients, there are some genetic diseases that patients can have. So if you have a family history of someone who has had an aortic disease, such as an aortic aneurysm or an aortic dissection, we ended up screening them a little bit earlier because we know that they have a family history of it.
And the aorta is the largest artery in our body, correct?
Right. So it's the biggest blood vessel in our body, and it's the big blood vessel that comes off the heart. It goes up and gives up the blood vessels to the brain, to the arms, to the legs, and to all the blood vessels in the gut.
And the good news is there are treatment options available. We'll get to those in a moment. But Cheryl, we want to hear more about your story. What sort of issues were you experiencing before you realized there might be a problem?
I really wasn't experiencing much of anything. Several years ago, I was really tired. I had been helping a friend, and I was at home getting ready to go to bed, and all of a sudden I had pain go through the middle of my back, and I thought I was having a heart attack and then I was going to drop dead. And I was so angry because I was not about to drop dead at that moment that I screamed out, "God, I'm not ready." And I mean, the pain went through my back. It was excruciating. It came around through the front. And the EMTs came, my husband called them, he heard me yelling, and they said I looked fine, but we went to the emergency room anyways, and the physician there, he said, checked that out fine, and they kind of wanted to send me home, and I knew I was in trouble because I felt exhausted. I just feel like I've been run over by a truck. And I stuck to my guns, and I kept really falling in and out of kind of consciousness. I don't know if they knew that, and then before I knew it, I was life-flighted downtown to Memorial Hermann. And then Dr. Kahn did another surgery this December on me because I had another aneurysm. So I had 2 aneurysms before, and then I had another one, and she did a new procedure on me, which was great.
It's really fantastic, the type of fighter and will that you have, especially at that first episode. And Dr. Kahn, when you hear about this, and the pain initially for Cheryl was in her back, I think many people would think, well, how would that relate to a heart attack? Or, you know, you might brush it off, sort of like what other people were telling her, but she ended up having both open and endo surgery to fix that aorta. This is something that you need to act quickly on. If you feel like something is wrong, trust your gut.
Exactly. So the kind of chest pain and that excruciating back pain that she was having is pretty standard for the type of disease that she had. It's actually what they teach us in textbooks. When you hear that, you know, those are the patients that you want to get to the emergency room just like she did. And they usually get CT scans that'll actually show the disease right there for us. And then we can make the appropriate plans for surgical intervention.
And do the treatment options really depend on the severity? Like, are there different degrees, I guess, of aortic disease?
Yeah, so it depends on size criteria, on where the tear or the disease is actually happening, how long the symptoms have been happening. So the best thing anybody can do is, you know, if they know they have this, they should head over to an emergency room, or if they have a vascular surgeon or a cardiac surgeon they already know, give them a call. I know a lot of things are a little bit different with COVID, but all of our offices are open, and they should be evaluated because a lot of times we can make the decision about whether or not something needs to be treated with surgery, whether it be open or endovascular, or if they can be managed with some medications that can help treat these too.
And time is of the essence, of course. And when we talked about how to prevent this earlier, I mean, the biggest red flag, doctor, is what you said. If you're a smoker, you're at high risk here. So obviously stopping smoking, what else can we do?
The biggest thing you can do is stop smoking. Also, if you have ever smoked and even if you stopped, you can get screened. You can meet up with a vascular surgeon, exercising, eating healthy. And again, if you have a family history of someone who's had aortic disease in the past, it's that you want to be checked out. You want to tell someone that, hey, I have a family member who had an aortic aneurysm when they were young, and get screened at that time too.
Cheryl, you know, it's hearing your story just reminds all of us how lucky we are to live in Houston and to have access to some of the best medical care in the world. Tell us how you're doing today. How have you been feeling?
I'm doing well. I mean, I was really shocked that I was having a heart issue initially because I was a vegetarian and I did a treadmill every day for 3 miles. So I was in really tip-top shape and my heart really was in good shape. So it was a real surprise that I had this issue. And but when you know there's something wrong, you just have to trust your gut and instincts and just, you know, persevere and just tell them you're not going anywhere.
Amen to that. And you look great, by the way. And we're glad that you're here to tell us your story and warning signs to share with others. Dr. Khan, can you talk to us about some people who might be able to receive a free screening for this?
So the guidelines show that if you're between the ages of 65 and 75 and have ever smoked, you can give our office a call and we can see if you qualify for an abdominal aortic aneurysm with an ultrasound screening.
Well, and catching it before it becomes a problem seems like it would be key. Cheryl, Dr. Khan, thanks so much for your time, Cheryl. It's great to see you doing well.
Thanks so much.
Thank you. And if you would like more information, you can visit utphysicians.com or you can call 713-486-1160.